I'm going to show you how to make a ClinCheck for a moderate type case be super predictable and also minimize attachment placement because nobody loves attachments. So here we have a case. Let me take the attachments off just for a moment. And what you might notice is a bit of an asymmetry, and you'll truly appreciate what's going on here when you look in this view. An experienced orthodontist probably can guess that this is the result of a bonded splint. This is not a natural sort of shifting or positioning that you'd see in teeth. This is iatrogenic because a bonded wire was placed, but it was placed meaning to hold the teeth in place, but instead it kind of pushed this out here and it flattened this area over here. So we definitely want to make this arch form more symmetric. So this is what our goal is going to be with Invisalign. On the upper teeth, what we have is minor crowding, where you'll notice that the laterals, one is out a little bit and one is in a little bit. The upper midline happens to be onto the face. At the end of the treatment, we should see that line up as we treat the lower. But here's what I want to do to this ClinCheck. So first of all, I had in my settings to not move the molars at all. No reason to do that. And remember, what I didn't tell you, so you can't remember yet, but let me rephrase this. This patient is around 50 years old. And so they are functioning absolutely fine with this occlusion. And they should. It looks great. So I'm not worried about micro details. And in terms of the incisal edges, let me show you something. The ClinCheck came back, and take a look at the upper anteriors here. And now look at this ClinCheck. Now what you notice from here to here, I didn't ask for this, but you'll notice a dark triangle, and you'll notice some extrusion and also distal root torque of the upper right one. Now that was done maybe to make the incisal edges look better. And the same, there's distal root torque on the upper central, left central. So look at the laterals. Also, mesial root torque and extrusion. And it actually creates that incisal embrasure. And then here we have extrusion, which is nice in theory, except the gingival margin is pretty balanced and it's hard to purely extrude a tooth. And we don't really necessarily need it. This patient is coming in for a different set of issues, especially the way the lower looks kind of funky. So I'm going to simply, you could explain this to the technician, but what I do is, and by the way, that attachment is there because that was required to give that distal root torque. So I'm going to just kind of put it back where it is, like here, and I'm going to remove that extrusion. And see, there's no extrusion. And then at the end of the treatment, I could do enamelplasty here, or we could leave that step where the laterals are a little shorter. I'm going to remove this extrusion. And I'm going to even remove that mesial crown torque or distal root torque. So now you see tooth barely moving, at least in the plane that's difficult, and you can still improve the alignment really by moving the other teeth. And now I'm going to take off this attachment because I don't need extrusion and I don't need mesial root torque. And on the lower, I might leave the lowers. Patient isn't as concerned. I certainly need something to kind of extrude that canine, but hopefully this will help you minimize attachments and make your case more predictable, because I'm still going to get everything I want in this case without having to do anything with regard to difficult movements.